My name's Lisa Lintott. I use she, her pronouns, and my presentation is entitled Domestic Violence and Abuse in Rural and Remote Communities, a Public Health Issue. Oops, hold on. In the spirit of reconciliation, I acknowledge that I live, work, and play on the traditional territories of the peoples of Treaty 7, which include the Blackfoot Confederacy, the Tsuut'ina Nation, and the Stoney Nakoda. The city of Calgary is also home to the Métis Nation of Alberta. Before I begin, I want to let you know that some of what I discuss may be triggering or upsetting, so please ensure that you take care of yourself. Go ahead and mute me and walk away. I'm totally cool with that. During my practicum, I had the privilege of working with a domestic violence and abuse emergency shelter located in a rural area of Alberta. As studies suggest that rural and remote communities are more susceptible to domestic violence and abuse, including domestic homicide, I found it crucial to explore the impact of rurality and remoteness in such cases. My practicum did focus on domestic violence and abuse experienced by women. However, it's very important to note that there are other terms used to refer to this issue, such as IPV and gender-based violence, for example, and that domestic violence and abuse can affect individuals of all genders. I do sort of switch back and forth between using DVA and domestic violence and abuse. DVA refers to a range of behaviors used in any relationship to gain control or power over the other person. Such behaviors may include verbal, physical, sexual, psychological, emotional, spiritual, and economic abuse. Although anyone can experience DVA, women are more likely to be affected by it, while men are more commonly the perpetrators of it. DVA's long-term physical effects are poorly understood, but it has been correlated with worsening menopause symptoms, an increased risk of diabetes, and the exacerbation of risk-taking behaviors. Women who experience DVA exhibit higher rates of chronic diseases, STIs, substance use and misuse, smoking, and elevated cortisol levels. Domestic violence and abuse causes physical and mental harm, unintended pregnancies, and emotional issues in children who witness it. Individuals exposed to DVA are more likely to experience or perpetrate it later in life. It can also negatively affect employment, housing, and education, resulting in financial instability. DVA has a disproportionate impact on certain groups of women, including Indigenous women, women with disabilities, 2S LGBTQIA+ folks, immigrant women, and those who lack education and employment opportunities. Domestic violence and abuse is a significant public health issue that affects women globally. It is caused by various factors at the individual, family, community, and societal levels. This problem is considered a human rights violation and affects 1/3 of women around the world. The risk factors that contribute to DVA include controlling behaviors, violence, gender inequality, limited job access, low education, and sexual violence. DVA is a major concern in rural and remote areas of Canada. It's crucial to bear in mind that most cases of DVA are not reported to police and RCMP. Therefore, published statistics are likely very much higher. The underreporting of certain types of violence, including sexual assault, has been well established, and other forms of victimization, such as psychological abuse or financial exploitation, are not always considered criminal, and thus are absent from police-reported statistics. Saskatchewan, Manitoba, and Alberta report the highest DVA rates in rural areas. Women in rural areas experience higher DVA rates than those in urban areas. Domestic homicide rates are higher in rural areas. Indigenous people in rural and remote areas are also disproportionately affected by violent crime and are more likely to experience spousal violence. Women in rural and remote areas live with unique needs and barriers in terms of domestic violence and abuse. Some of these elements are isolation and geography, economic issues, traditional and patriarchal social values, barriers to service, public visibility, strong traditions in community around firearms, farming, the after effects of separation, and housing. In the interest of time, I'll summarize 2 points. Firstly, victims of domestic violence and abuse in remote areas, especially in the northern regions, face significant challenges due to geographic and social isolation. This can include a lack of transportation options, insufficient domestic violence and abuse services, unstable phone and internet services, and minimal access to RCMP and healthcare services. Secondly, in close-knit communities where privacy, anonymity, and confidentiality are sometimes precarious, victims may find it difficult to seek help, particularly if the abuser is a prominent member of the community or has a dual relationships with service providers and law enforcement. Moreover, Indigenous and immigrant women face additional challenges due to intersecting risks, which further increases their vulnerability to domestic violence and abuse in these settings. Domestic violence and abuse should be addressed using a systematic approach that incorporates public health and social equity concepts. Provinces and territories must recognize it as an epidemic and focus on mitigating the risk factors such as poverty and housing insecurity. We need to explore more flexible and innovative methods for providing services that cater to the unique needs of those in rural and remote areas. Perpetrators of abuse face similar barriers in accessing help, such as geography, isolation, patriarchal norms, and a lack of services. Aside from being made more accountable for their actions, the perpetrators of abuse should also be offered a safe at home program that removes them from the home. Close monitoring and psychosocial interventions are also necessary to address violence and related issues, such as mental health and addiction. If the issues related as to why and how an individual commits domestic violence and abuse are not addressed, this violence and abuse will continue to negatively impact the health and welfare of a large proportion of the population, including children and public health in general. Research shows that DVA rates are higher in rural and remote communities than in urban areas, despite the perception of peace and safety in these areas. Geographic factors, social norms, and attitudes unique to these communities have a significant impact on the experience of domestic violence and abuse victims' access to support services. To tackle this public health issue, a comprehensive approach involving community education and awareness, sustainable and equitable funding, policy changes at all levels of government, and support networks is required. This is an epidemic with far-reaching implications, not only affecting the overall health and quality of life of the victim and those who witness it, but also a preventable human rights violation. And finally, I'd like to express my gratitude to all the individuals at the Domestic Violence and Abuse Shelter, where I had my practicum, for their unwavering support and generosity in sharing their experiences and time with me. I'm also deeply grateful to my family and friends for being my constant source of encouragement and support throughout my MPH journey. Thank you.